Hi there, students. I'm here to talk to you about the liver and biliary system. So when we're looking at the liver, we have the right and left lobes with the falciform ligament and the gallbladder. The liver is the largest gland in the body. The falciform ligament divides the liver into two major lobes. So there's the right lobe and the left lobe, and there's two minor lobes that are also on the visceral surface. It's the caudate and the quadrate lobe. So when we get into your sectional anatomy class, we're going to cover that a lot deeper than what we are here. So there's two major blood supplies to the liver. So there's the hepatic artery that supplies oxygenated blood from the abdominal aorta, and there's the portal vein, which carries blood from the digestive system to be filtered by the liver. And as you can see here, this side is the right. We have the right lobe, and over here is the left lobe. In between, we have the caudate and the quadrate lobe. You have your inferior vena cava with your gallbladder right there. So the primary function from our standpoint in imaging is the production of bile. Bile is collected by ducts and carried to the gallbladder for storage, or it can pass directly into the duodenum. So the biliary system consists of bile ducts and the gallbladder. So there's two hepatic ducts. There's a right and the left, and the right and left hepatic ducts join together to form the common hepatic duct. So the common hepatic duct unites with the cystic duct to form the common bile duct. So the common bile duct then joins the pancreatic duct, and together they empty into the duodenum through the ampulla vator. So the ampulla is controlled by sphincter, and we call that the sphincter of Oddi, whatever you want to call it. So here is your left and right hepatic duct going to your common hepatic duct. Here's your cystic duct joining in with your common hepatic duct to form the common bile duct. Then you have your pancreatic duct joining together here. So this is your gallbladder, and this is the C-loop of your duodenum. So coming down the common bile duct and your pancreatic duct, we go to the ampulla vator, and then you have your sphincter of Oddi with your descending duodenum. Here's another picture of the falciform ligament with your quadrate lobe with your left lobe, and you have your common hepatic duct here with here's your common hepatic duct, and then you have your common bile duct down where the two join in after your cystic duct. This is your pancreatic duct with your pancreas, and you have your ampulla vator here. Looking at a sagittal view, here's your liver, and you have your right and left common hepatic duct, and going into your common hepatic duct, going to your cystic duct. Here's your gallbladder to your cystic duct to your common bile duct, and here's your duodenum. So the gallbladder is a thin-walled, a muscular membranous sac, usually found on the visceral surface of the right lobe of the liver. It varies greatly depending on the body habitus of the patient. Its function is to store and concentrate bile. It evacuates bile when activated by a hormone, cholecystokinin. The neck of the gallbladder is consistent with the cystic duct. So the neck of the gallbladder is where typically the stones get stuck, and so beyond that there's no flow and it gets engorged, the gallbladder. So if we look here, we have the fundus down around the bottom, we have the body and the neck, and you have spiral valves coming around here in the cystic duct. And this is where, right here in the neck, is where the stones get stuck, and then this gets engorged. And here is an x-ray of the gallbladder. So A is your cystic duct or your neck. Cystic duct, and we'll call this the neck, and this is the body, and down here is the fundus. On ultrasound, this is what it looks like right here, because it's fluid filled, so it looks a little bit different than it does on x-ray. And like I said, depending on the body habitus on your patient somatotype, so you have your hyperstenic, your stenic, your hypostenic, and your asthenic. So you can see it really changes position depending on the body type. So the first, there's three procedures that we're going to cover. The first one is the percutaneous transhepatic cholangiograms, what we call it. There is the postoperative, so the T-tube cholangiogram, and there's the endoscopic retrograde cholangiopancreatic Pancreatography. So in ERCP, that's a mouthful. So your percutaneous transhepatic cholangiogram, we abbreviate that the PTC. It's performed on patients that are jaundiced when the ductal system has been demonstrated as dilated, usually on CT or ultrasound, but they don't know why. So may also be used to place a drainage catheter to treat obstructive jaundice. So if there's any kind of obstruction, they're going to put that in to help drain. So the patient is supine, so the right side is surgically prepared and draped. A local anesthetic is administered, and a special skinny needle is called a chiba is inserted. You'll hear them just refer to the chiba. We use water-soluble contrast is injected, and after the ductal system is filled, we take AP projections to verify that we're in the proper location. So here is a picture with the chiba needle right here with the arrow. This patient's had surgery, as you can see all the surgical clips, so you can see the ductal system there. And you can see there's a stone right there blocking everything, so you can see it's very dilated. And here also, this is from trauma right here. So, okay, so a postoperative T-tube cholangiogram. So it's also called a delayed cholangiogram. It's performed via T-tube left in the common hepatic and common bile ducts for postoperative drainage. So it's performed to demonstrate the caliper and patency of the ducts, the status of the sphincter of the hepatopancreatic ampulla, and the presence of residual or previously undetected stones. The tube may be clamped the day before procedure. It fills the tube with bile to prevent air bubbles from entering, and air bubbles mimic radiolucent stones, as you probably are aware of. So the preceding meal is withheld, so they usually have surgery in the morning, so dinner is withheld, and we give an enema 1 hour before the procedure. And sometimes we'll take a KUB just to take a look at the system. The patient is positioned in the RPO with the right upper quadrant centered to the IR. The contrast is injected through the T-tube under fluoro, and we take spot films as indicated or needed. So you can see here, we've got your T-tube coming in right here. So your T-tube, you can see how it's the shape of a T. You have your right hepatic, here's your left, and coming into your hepatic duct, your common hepatic. And you can see the pancreatic duct right there. So this is your common bile duct here. And here's another image of a T-tube cholangiogram. And you can see here, these are residual stones, so we need to make sure that those aren't air bubbles. So we'll move the patient around typically to see those do look like stones though. Okay, and ERCP. So we use those to diagnose biliary and pancreatic pathological conditions. So it's a useful method when ducts are not dilated and the ampulla is not obstructed. So it's performed by passing a fiber optic endoscope through the mouth and into the duodenum under fluoro. So the patient's throat is usually sprayed with an anesthetic to make the passage of the scope easier. The hepatopancreatic ampulla is cannulated, so we insert a little tube through there. Contrast is injected into the common bile duct, and spot images are taken. So this is, you probably all have seen this. This is kind of old picture because the doctor's looking through the scope. They can still do that, but now it's usually up on the monitors, which makes it a lot easier. They usually have a little metal piece on the tip so that we can see exactly where the scope is on the catheter once we insert that in. So here's an ERCP image. You know it because there is the endoscope right there. We have your cannulated right there. There's your little tube going in. Here's your pancreatic duct. Here's your common bile duct. Here's your cystic stump. So they had, you can see the surgical clips. They had their gallbladder removed. So coming up your common hepatic duct, since we're past the cystic duct, is your common hepatic, and you have your right and your left hepatic ducts. And here's some more pictures. You see the endoscope, great view of your pancreatic duct coming across on both of those. And you can see here they only cannulated the pancreatic duct, so it's nice. And you can see the surgical clips there, which tell you that the patient probably had their gallbladder removed. All right, that's it for this lecture. Quick and easy.